Now it's my turn. Okay. Cranial nerve 1 is olfactory, that revolves around smell. It's a sensory nerve. Today I will have Derek smell an alcohol pad. So I'll have him close his eyes. You smell that, Derek?
Oh, yeah.
Oh, yeah? Sorry about that one.
That's how you get high.
Absolutely.
I don't know what that feels like.
For cranial nerve number 2, we do visual acuity. It is a sensory nerve. You'd have them read. So let's see if we have something close here. Derek, can you read? Can you read what that word says above my thumb?
Web call.
And then over there, there's a red sign. What does that say?
Fire alarm.
Good. It's a sensory nerve. For cranial nerve number 3, it's ocular motor. It's a motor nerve. And for cranial nerves 3, 4, and 6, you could do the H pattern. So you would stand in front of your patient, and then start here. Go side to side, up, down, cross, up, down, cross, go to the middle, come in, come back out again.
Oh, hey, Dale, you want to get in the video?
Had to talk to the Dale Brown for a minute. So, we just got done with number 3. Cranial nerve number 4 is trochlear, which is eye movement focusing on down and out. So again, that would be the H pattern of coming across down. And then the pupil reactions. That is a motor nerve. For number 5, trigeminal, it's both a sensory and a motor nerve. It does facial recognition and motions of the mandible. So motions of the mandible could be talking as well. So let's do the sensory first. There's 3 portions that you have to check: the forehead, over here, and then lower on the jaw. So I'll have your patient close your eyes. Can you feel that?
Yes.
You feel that?
Yes.
You feel that?
Oh, yeah.
And then you're checking the other side. You feel that? You feel that?
Oh, yeah.
Okay, good. And then motions of the mandible, you would have them go side to side, up, down, and then protract and retract. And he could do all of that. For number 6, abducens, that's looking side to side. Like I said, cranial nerves 3, 4, and 6 are all taken care of with the H pattern. So it's start here and then have them track side to side. That's the middle bar of the H. That is a motor nerve. Cranial nerve number 7 is the facial, which is both a cranial and both a sensory and a motor nerve. This one revolves around taste and then also facial expression. I don't have anything for Derek to taste, but we could use either some Gatorade or Medialite packets. Then we would ask Mr. Simmons, can you taste this Gatorade? He would say yes or no. No, he cannot taste it. And then facial expressions. You can puff out your cheeks. And then if it was a flavor of Gatorade that he didn't like, he would put and make a face of it. Number 8, vestibular cochlear, is hearing and balance. So for this, you would get behind the patient. You would get behind the patient and tell him to differentiate between the left and the right. I would have Derek hears the sound, it's a snapping sound. Close your eyes, no cheating off of the camera. Raise the hand that I'm snapping behind. to your left, raise your left hand. Okay?
Okay.
Good. Oh, awesome. So that checks out. That's a sensory nerve. Glossopharyngeal is taste, and then swallowing. It's both a sensory and a motor nerve.
So I'm gonna take this alcohol.
So he's going to taste that alcohol wipe and then swallow it just to make sure. So, back to the original example of Gatorade. If you could swallow the Gatorade and taste it, that would be possible. It would be, that nerve would be fine. Number 10, the vagus nerve is gag reflex and speech. I've been talking to Derek this entire time. He's responded back, so that checks out okay. And then the gag reflex is the sensory part because the vagus nerve is both a sensory and a motor nerve. For the gag reflex, you would take a tongue depressor, and then you would try to stick it in there, and yeah, you get it. We're not going to do that because I like Derek. Number 11 is the accessory nerve. That's shoulder shrug against resistance, which is a motor. So you would get behind Derek, hands on his shoulders,
Ooh, yeah.
have him shrug his shoulders against resistance. That works. And then hypoglossal is tongue movement, so you would have them stick their tongue out to the left, to the right, up and down. That is a motor. That's a motor nerve. I don't know if I touched on accessory. That is also a motor nerve. And then vagus is both a motor and a sensory nerve. So, yeah.
Oh, really? You really hit all the bases. You really deserve an A on this.
Thanks, Derek.
You're welcome, sir.
All right.